Welcome to Evergreen Family Medicine. Today we are getting to know Dr. David Yecha. He is a family physician here with Evergreen. Welcome.
Thank you.
Tell us about your background a little bit. Where are you from and how did you end up at Evergreen?
I grew up all over Oregon. My family moved multiple times, but I actually went to high school at Douglas High School in Winston, graduated in 2009, and then I went to undergrad at Pacific University up in Forest Grove, medical school in Yakima, Washington, where I met my wife, and you'll get to hear more about her at a different time. And then we did our training down in Oklahoma. Really liked it, but our family's here in Oregon and in Washington, and I actually was an Evergreen patient years ago, and when we were looking for potential spots to work, we came down for the interview and loved all the staff and Dr. Powell, and we're just really impressed and felt like this is where we were supposed to be.
Well, you've been to quite a few places around the country then, so what are your impressions of Evergreen?
One of our absolute favorite things about Evergreen is there's very few places that we have worked where there's as cohesive of a team culture as there is at Evergreen. I mean, when Shane and I came on, we had a long orientation. We had an extensive amount of time where we were able to kind of learn the system that they use in terms of medical charts. We each have someone who works in the same office as us that we can ask questions, whether it's, what do you think about this, or how do I order this test? And that has just been so huge, because one of the things that we were nervous about coming out of residency was, we've never totally been on our own before. We can ask each other medical questions, but it's not like we're working in the same office, and it's not like we're always available. And so one of the things that we've just really loved is it seems that everyone really goes the extra mile to cover for each other. And that's something that we have really enjoyed and hope to continue to, I don't know exactly what the right word is, but perpetuate and be a part of.
So what are some of the things that you and your wife like to do? You talked about trails, so I don't know if you're just like kind of everybody else, like getting outside is the main thing. What do you like to do?
So we do love to hike. We have 2 dogs, and so we like to take them if we can. The biggest thing, even more than hiking, is we're really into our church. And it took us a little while to find one we're excited about, but there's one called Covenant Life Fellowship. That's where multiple other providers go here, and we've just really found a good home there. And so that's a big thing for us. Hiking, like I talked about, and honestly, those have kind of been the 2 things we've been doing because we don't have a ton of time right now. We're kind of trying to get established and get everything going. And so those have been the 2 main priorities.
Well, I want to ask you what it's like to be a family practice physician, or is there an area you like the most? But I also am just in the back of my mind thinking you kind of got to be ready for just about anything coming through the door, I would imagine.
Yeah, it's one of the things that appealed to both my wife and I about family practice is that you can, to a pretty large extent, kind of make of it what you would like. And one of the things that I really enjoy, so my wife and I are both trained in osteopathic medicine. We're DOs instead of MDs. And so I love to do manipulations. Now, it's kind of hard to explain quickly what exactly that is. Kind of the best corollary I can give to patients is it's similar, not the same, to like physical therapy, chiropractic type techniques. I don't love popping people necessarily. If they really want that, we can try for that. But it's really kind of trying to figure out, okay, what's going on with the patient's body in terms of the skeleton, in terms of the muscles, where are things out of alignment, and how do we get them back to that? Because the whole osteopathic philosophy is the body can heal itself. And so if we can sort of get things back, and then the example I always try to give patients is, okay, well, here's some things I did for you today. Here's a couple modifications you can do for yourself at home. Because if it's the same analogy, if you give a man a fish, you feed him for a day. If you can teach a man to fish, you feed him for life, right? And so it's that principle where we try to figure out, okay, where can I help patients figure out what they need to do so that eventually they don't really need me anymore.
And isn't there also an element to this that maybe it cuts down on the amount of medicine a person needs to take or potentially the drugs that might have some side effects. If you don't need to take those, then there are these options that come from that DO training.
Absolutely, and it's not just the DO training that has that, of course. There's lots of MD docs who are very much proponents of let's get rid of some of these unnecessary meds, and so I don't want to belittle that at all, but it's very much absolutely something where we're kind of like, okay, we want you to be healthy. There are some different ways we can get there. One way is medicine. There's also diet and exercise. Sometimes patients are really want to try some sort of a natural supplement. And so that's something my wife and I have kind of been looking into as well, or what are some ways we can equip patients to do that if that's something that they would prefer to do. And so it's really kind of trying to find, okay, where is the patient? How do we meet them there and bring us both to where we want them to go?
Thank you, Dr. Yecha. Appreciate your time today.
Thank you.
Dr. David Yecha with Evergreen Family Medicine. You can see his bio and learn more about the other providers at Evergreen Family Medicine online at evergreenfamilymedicine.com, and you can follow Evergreen on YouTube, Twitter, Facebook, and Instagram.